Okay, so we worked with a little 20-month-old girl with Down syndrome. We performed the Peabody to assess overall gross motor skills. So we looked at stationary, locomotive, and object permanence. We also looked at her general fine motor skills and her overall tone.
The five problem areas that she had that we observed were her walking, standing balance, hypotonia, limited speech compared to typical children of her age, and poor postural and trunk control. The single main problem that we were thinking to work with her were independent standing and walking. This is because she initiates the stepping motions with her feet um, with a wide base of support, stiff knees, and feet are externally rotated in cruising. Standing while she does this by standing with support by providing stability in her pelvis when walking.
She also has pes planus and calcaneovalgus.
We discussed how the pes planus, pronation, and calcaneovalgus may affect her walking and potential use of orthotics in the future. We're having trouble finding evidence-based interventions because she's so young. It just talks about structured play, but not really how to accomplish what you want to accomplish through that structured play. But we did come up with an outline where we will do some assisted walking with the scooter. We brought it out during the eval, and she really enjoyed it. We also have some postural control exercises, potentially with the ball. She seemed to really like that, so we thought maybe we would have her supported standing with her arms free so that she could throw the ball to kind of challenge that base of support a little bit. Or even do it in sitting. We can have her do some reaching activities or throwing the ball, which will also kind of challenge those trunk control muscles. We've considered treadmill training. There's good evidence for children who can sit for 30 seconds independently to put them on a treadmill and have them take some steps. And then we were just doing structured play, whatever she is kind of trying to do to see what we can accomplish while she's doing it.
So to further our knowledge about her and this case, and to just kind of help us come up with some more interventions that we could work on with her, we thought we could research physical therapists' role in speech development because she's slowly developing it, or maybe even throw in some sign language with baby development. Strength training in infants with Down syndrome to help facilitate strength in the lower extremity to help with gait and balance. Also, gait and compensatory patterns for children with Down syndrome, since children with Down syndrome tend to hyperextend their knees and they always have pes planus and calcaneovalgus. And then research-based interventions for infants with Down syndrome, just to help us facilitate some interventions that we could do with her. Parent involvement in physical therapy at home to further her development. And then home exercise program for children with Down syndrome, again at home with her parent. And orthotics for children with Down syndrome, since a lot of children with Down syndrome tend to need orthotics when they start to stand or walk.